back to another segment of Ridgepoint High School Health and Psychology. I'm Emma Watson.
And I'm Abby Simmons. This week we are talking about paranoid personality disorder. This disorder is an unwanted tendency to interpret the actions of others as deliberately threatening or demeaning.
This disease is common but not often diagnosed, which could lead to long-term problems for the patient. Treatment for paranoid personality disorder is psychotherapy.
There are 3 types of psychotherapy that can benefit the patient the most. The first type is behavioral psychotherapy. This type of approach tries to encourage the patient to help reestablish bonds between members that are close to them, like family members or friends. Another approach is a cognitive approach. This encourages the patient to think more optimistically. Finally, there's a humanistic approach. In this approach, therapists help try to convince the patient that not everyone is out to get them.
Medication can be used for extreme cases in anxiety, but you have to make sure that there are no side effects that come along with the antidepressants and antipsychotics that would cause harm to you instead of good.
To continue, some things that might influence the success of the treatment are the availability and want to take medication. Not everyone is going to want to take medication because some of the side effects could outweigh the positive effects of the situation. Also, they might not want to do the treatment because they're paranoid and they feel like maybe even their therapist is out to get them. This is common when the therapist and the client have a complicated relationship, and they can lose trust, causing the patient to not trust the drugs that the therapist would prescribe.
Some prevention strategies to help build resilience and promote competence would be to have yourself or the patient be more optimistic, and to have a lot of self-praise and praise from others by maybe just leaving little sticky notes around your house that give a compliment or a quote or something inspirational. Some specific treatment for specific events such as anxiety attacks or feeling depressed could be breathing patterns or therapists that could help you look at situations in a more practical and positive way so the mind doesn't feel that people are out.
It's beneficial to start out on one-on-one therapy with the therapist and yourself. This is a better idea because the patient could feel more anxiety from the group members if it was a group therapy situation. However, if over time there's improvement between the therapist and the patient during one-on-one therapy, it would be beneficial to move to a group setting so that the patient could learn how to interact and get over their paranoia of being disliked by others. This has been the Paranoid Personality Disorder segment on the Ridgepoint High School Health and Psychology channel. I'm Abby.
And I'm Emma.
And this has been the Ridgepoint High School Health and Psychology channel.
Bye!